Welcome to the PublicHealthPreneur Podcast, the show that helps you navigate the intersection of purpose and profit to make impact and income. I'm your host, Quisha Umemba, a registered nurse, public health practitioner, nonprofit founder, authoress, and entrepreneur on a mission to ignite conversations that matter. I've dedicated my career to the pursuit of health equity and to transforming the lives of individuals and communities. And now my passion project is empowering public health professionals to become public health entrepreneurs. My journey is a testament to the potential of this field, and my goal is to ignite that potential within you. Here's what you can expect. In this podcast, we will dive deep into the world of, well, you guessed it, public health and entrepreneurship. Whether you're a seasoned entrepreneur looking to expand your impact, or you're new to the field of public health and consider yourself to be a public health enthusiast, this podcast is your go-to resource for valuable insights and actionable advice, helping you to challenge the status quo and break free from convention to become an unconventional agent of change, creating meaningful and sustainable impact for those you serve. Let's get into today's episode. You ever heard the saying, if I had $1 every time someone asks me, fill in the blank? Well, that's exactly how I feel when people ask me, what does a public health consultant do? Like, seriously, I wish I had $1 every time someone asks me that. Well, welcome to the Public Healthpreneur Podcast, Season 2, Episode 3. I'm going to be talking to you about exactly what a public health consultant does. So here we go. Generally speaking, a consultant, just a plain old run-of-the-mill consultant, is just someone who gives specialized advice and guidance in their area of expertise. Now, anyone can be a consultant. You can be a consultant in business development. You can be a consultant in marketing. You can be a consultant in IT, communications, legal. You can be an educational consultant. You can be a consultant in just about anything. And regardless of what field that you work in as a consultant, you're going to work with groups or organizations. And so in public health, we work with, chances are, most of the time, we're going to work with healthcare systems, health departments, nonprofits, foundations, academia, just a run-of-the-mill, sometimes even corporate America. I've had corporate clients as well. But ultimately, when you're working with these organizations, you're helping them determine ways that they can improve the public's health or certain populations' health. Public health consultants establish business models or ventures to sustain the work that they do with organizations. I think this is really important for people to understand. If you're a public health consultant, specifically a public health entrepreneur, you are in business. You are a business person. You are self-employed. You need to have a business model to sustain your work. And so these models can include nonprofit organizations, and I know several public health consultants that are in business as a nonprofit. It can certainly be a for-profit venture, as I have with Umemba Health. It can be a social enterprise. It can be consultancy service, what have you. It's a number of different business models that you can adopt, but this is what ultimately makes a public health consultant a public health entrepreneur, which we talked about in our last episode. Now, public health consultant can take on various roles and responsibility to drive change in the public health landscape. Okay, so we talked about already, you have an area of expertise. You are providing guidance. You're providing technical assistance, which is the word that the federal government likes to use a lot, to those organizations, to governments, to healthcare institutions, to academia, to communities. And again, your primary focus is helping your clients address public health challenges, helping them improve health outcomes, helping them implement those strategies and programs and initiatives in the community or in the population that they're serving. Now, you probably know, if you have a degree in public health, that you can come from a number of different backgrounds in public health. And so there's epidemiology, there's biostats, there's health education, which is my background. So my emphasis, I have a master's of public health with the emphasis on health behavior and health education, human behavior and health education. You can do policy analysis, you can do program management, you can do global health. There's a number of different backgrounds that you can bring into the space. And then you use your expertise to tailor your services to meet the needs of the clients that you're going to serve. And so the work that you do can include anything from conducting needs assessments to program development to training and workforce development to policy work. I mean, the list really goes on and on and on. And if you purchase my book, Public Health Entrepreneurship, Navigating the Intersection of Purpose and Profit, there's a long list, not exhaustive, of course, but very long list of different types of work that you can do as a public health consultant. I'll just go over a few of these, and specifically ones that I know that some of my friends and colleagues do as well. So first is assessment and analysis. So as a public health consultant and entrepreneur, you can conduct assessments and data analysis to help identify public health issues and areas of concern. You can also evaluate existing programs, policies, and systems to help organizations determine their effectiveness as well. You can do strategic planning, right? So helping organizations develop their strategic plans and then provide recommendations based on those assessments. And so these type of consultants work with clients to help them set their objectives, define their goals, and create actionable plans that address public health concerns. You can do program development, which is one of my favorite things to do and how I was introduced in public health. And so this involves designing, developing, and implementing public health programs or public health interventions. And a lot of times you're creating evidence-based strategies. Sometimes they're innovative, but they're a lot of fun. You're tailoring these programs to the community, and then you're measuring or evaluating the effectiveness of these programs as well. There's all sorts of things you can do. You can do research and evaluation. You can do community engagement. I have a colleague and also a co-author in my book that is a community engagement consultant, where she engages with communities and with organizations and stakeholders to make sure that their public health initiatives are culturally sensitive and inclusive and responsive to the community needs. She is the community translator, helping to facilitate partnerships and collaborations to enhance program outcomes. And of course, you can do what I do in Umemba Health, which is training and capacity building, where we provide training and workforce development services to public health professionals. And that's workshops, seminars, educational sessions, that's leadership development, that's curriculum development, e-course development. I mean, you name it, anything that's going to be a tool that the organization can use to equip their workforce to be more successful in their role in engaging the community is something that you can do as well. So again, the list goes on and on. Health communication, quality improvement, emergency preparedness, grant writing, really the sky is the limit. And so this is what I tell people that call me, and I probably get this call once a week. Like, I'm just getting started. I don't know what to do. I don't know where I should focus on. What are people paying you to do in your 9 to 5? Are you developing programs at work? Are you sitting on committees at work? Are you doing any kind of strategic planning at work? Are you developing resources for toolkits or handouts or, whatever you're doing at work? It's the same thing you can do as a consultant. Like, seriously, it's not that hard when you think about it. Okay. So that is what a public health consultant can do. And again, that is just the tip of the iceberg. There's more information if you buy the book. You can get it on Amazon or my website at QuishaUmemba.com/book. I hope you found this podcast episode helpful. And in the next podcast episode, we're going to be talking about the public health consulting landscape. So I'm sure you want to know how much you can make and how many consultants there are and what type of contracts you can get and all of that stuff. And so I'll share that with you in episode 4. Stay tuned. Thanks for tuning in to the Public Healthpreneur Podcast, the show that helps you navigate the intersection of purpose and profit to make impact and income. I'm Quisha Umemba, the Public Healthpreneur, and I hope you enjoyed today's episode. For all things public health entrepreneurship, be sure to follow me on social media at Quisha Umemba or the Public Healthpreneur. You're also invited to join the Public Healthpreneurs Facebook group, where we continue the conversation after each podcast episode. Need help to start, grow, and scale a profitable public health consulting business? Hire me to be your coach. Want to pick my brain? Buy my book, Public Health Entrepreneurship, Navigating the Intersection of Purpose and Profit, available at all major book retailers and on my website at QuishaUmemba.com. Until next time.